Michigan Health Star. We are talking again with attorney Bill Dobreff about medical ethics, his work with the fighting the pharmaceutical companies for children. Millions of Americans take these PPIs for stomach acid problems. This I pulled from WebMD, was very interesting, and it says that proton pump inhibitors were the 9th most commonly prescribed drugs in 2015 ahead of thyroid medication. These include Nexium, Prevacid, Prilosec. So the problem is too, when you're taking stuff that is antacid, your vitamins and minerals aren't being absorbed and metabolized like they should, and people are developing long-term intestinal disorders because their bad bacteria is taking over and they're getting infections like C. diff, SIBO, some of the other things that we've talked about. Side effects, which can be diarrhea, pneumonia, low magnesium levels, which is pretty chronic for everybody in the United States. You get those cramps in your arms and your legs all the time. It also causes muscle spasms from the deficient magnesium, heart palpitations, convulsions, and now they're saying chronic kidney disease. Basically, if WebMD is saying it's bad, it's pretty bad. And from what I can see, people making their own case studies on Facebook and on the internet complaining, people are basically saying they're dying from this drug. Scott Gabbard, MD, a gastroenterologist at Cleveland Clinic, Ohio, says many of his patients have become frightened of PPIs because of the side effects. So he's doing his homework now so he can fully explain the risks. And again, if you want to know about your drugs, always look at the package insert, ask the doctor if they don't want to give it to you, Google it. Let's talk now to Bill about medical ethics. What are you seeing in terms of these PPIs in relation to like vaccine, the opiate epidemic? Are we going to be able to hold these drug companies accountable in the future?
Well, as you're pointing out, lots of times these pills that the pharmaceutical companies make billions or millions of dollars on an industry, the cure can become the problem. And when you take any drug, you should be making a calculated risk-benefit analysis. When the problem is only heartburn, how much risk is it worth to eliminate that problem?
Right.
Is it worth breaking your wrist? Is it worth dying? Is it worth your teeth falling out? Is it worth impairing your immune system? Second, you have to look at, are there alternative methods of curing these problems? Heartburn, change your diet.
Right, right.
2,
and also
consult an alternative medicine person.
Thank you for that. So why can we see in the future maybe doctors talking about this with their patients?
They have to, and sometimes the doctors aren't to blame because they aren't getting the information from the pharmaceutical companies. Obviously, the pharmaceutical companies benefit by more sales. Disclosing risks and hazards and injuries decreases sales. So it's kind of that they have a financial interest not to tell you everything that's wrong. And then how do they tell you? Is it in the small print? Is it bolded? It's critical in terms of, as we said before, vaccines, but with any drug or medicine, that you know what the side effects are. So 1, you can know to stop taking it. 2, you can know to go seek treatment if this thing is causing problems. How would you know if you're not being told?
A lot of people I talk to don't put their symptoms together. They have so many different symptoms and they never seem to put it together. Wow, all these drugs I'm taking could be interacting. And to me, it's very, very clear. You can see the path for this happens, this, you take this, this happens, now you need a drug to take this. It creates a cycle. I want to know what we can sort of expect in the future for pharmaceuticals. Do you see in the future maybe more people coming together? I know for my friends in the medical community, I have a lot of friends that are medical doctors, and they're sick of it too. They're counting on the pharmaceutical
companies.
Doctors
don't want to hurt their patients.
No.
I mean, they're there to help, but you know, they can be victims of this too, just that it isn't out there enough. And the other problem that you point out is interactions of drugs are huge. And the doctors have to know every drug you're on and then realize that certain drugs, if you're on it, you can't take these PPIs or take some other form of medication. So it's a detailed history. There are other people who medicines, drugs are contraindicated in because they're high risk. The very nature of certain other conditions they have make it prohibitive health-wise for them to even try that drug.
I think the MAP, which I talked to Judge Linda Davis about, really pushing doctors to log all these drugs so that everybody can be aware of what everybody's on. I think that would make a huge difference because medical drug interactions are very, it's like one of the top killers in the United States.
Well, one of the benefits you do have now is you have things like Facebook, Google, and you have source information that if you can get the warnings and the data out there, independent of the drug companies, people can find it.
And Facebook has been amazing in terms of what it's done for the medical community. I know for medical devices and people who've been sick from breast implants for years and we're just going from doctor to doctor to doctor, just piecemealing everything together. Well, I got this chronic rash, put a steroid, and then I got this chronic migraines, take this. And then what happens is at the end of the day, nobody's saying it's your breast implants. And then because of Facebook, people are logging and basically putting their own symptoms together, or creating their own case studies on Facebook. Now people are finally getting help and holding the people who need to be held accountable so we can make real change.